Molar incisor hypomineralization is a mouthful, isn't it? And it's a very common condition that we see in probably 20 to 30% of children here at the practice. It's a developmental defect of the teeth, and what that means is that the teeth develop a weakness in the enamel as they're growing, and that happens in utero. So the teeth affected by molar incisor hypomineralization are the first permanent molars, and those teeth start to develop from around 8 months in utero, meaning that children are still in their mummy's bellies at that time, and those teeth continue to lay down hard tissue until around 3 years of age. We know that children who have been born preterm, where there are complications in birth or delivery, or children who are sickly from age 0 to 3 years of age, are more likely to present with molar incisor hypomineralization. Sometimes parents feel guilty that they've done something wrong, but I can assure you it's nothing that parents have done wrong. It's just one of these things that can happen with the development of the teeth. It can be a tricky condition to treat for a number of reasons. The teeth can be very sensitive. So children who present with molar incisor hypomineralization, or MIH for short, will often experience dental anxiety because of the fact that they know what pain is like before they've ever come to see the dentist. They will have experienced sensitivity eating cold things or brushing their teeth. So their teeth can be very, very sensitive, exquisitely sensitive already before they ever have any treatment done. The teeth are soft. They used to be called chalky molars in the past, and they break down very easily. And when they become decayed, the decay can travel through the tooth very rapidly. So a tooth might just be in the mouth for a very short space of time, and within a few months, the tooth can go from looking like it has an intact structure to breaking down completely. So decay travels very quickly. Sometimes without the tooth being decayed at all, the tooth can just break away and it just crumbles apart. The tooth can have anything from a small white patch to a large yellow area that covers the entire tooth. So we get different severity. We can get anything from a very mild form of the condition, it might only affect one molar, to a very severe form where 4 molars can be affected. The front teeth can also be affected. So we might see little small white spots or cream spots on the front teeth. Those aesthetic defects can be dealt with. We can take away the defect. Sometimes we can just remove a very shallow surface of the enamel on the front with a technique called microabrasion. Every case has to be selected based on its severity. The good news about molar incisor hypomineralization is that it doesn't affect the premolars, which are adult teeth that are up to age 11 or 12. It won't affect the second permanent molars, and if there are wisdom tooth, which is the third permanent molar, those teeth will not be affected. So it's specific to the first permanent molars. It is an important condition to take into account when doing orthodontic treatment planning. The first permanent molar is a big tooth, it's very structural, and sometimes what we might do is keep that tooth in the mouth until a very specific window of dental development. And if the timing is right, and if there is enough crowding and spacing in the mouth at the right time, we might take out those teeth and allow the other adult teeth to come into that space. So every case must be taken on its own merits, and they're all specific. But the important thing is to pick up MIH early. That really helps. And to make sure that children are given as much preventive care as possible.